On this episode, I'm really excited to talk about a concrete solution that can help us move towards better comprehensive reform of our safety net to encourage work and family formation and true upward mobility. To help us have this conversation, I'm very excited to welcome into our virtual studio U.S. Senator Jon Husted from the state of Ohio. Senator Husted, welcome to Defending Ideas.
Great to be with you.
Senator, I'm grateful for your time and your work on this issue because you have a bill called the Upward Mobility Act that's really kind of tailored to helping to fix this problem. And I would describe it as sort of clearing the path for families who feel stuck in poverty, who want to get off of government programs and enjoy the benefits of work-based self-reliance in our free enterprise system. So maybe can we start there? Can you go ahead and give us a brief overview of the Upward Mobility Act? What does it do?
Well, I think the most important question, is before I review it is why? Why do we need it? Because we have something called the benefits cliff. And what happens is you have many families, a single parent with two children, they may be working 20 hours a week, making $17 an hour. But if they worked 21 hours or got a raise, they might lose thousands of dollars worth of benefits. What are those benefits? Things like housing assistance, childcare assistance, SNAP benefits, things that are part of the 8 programs that we're really targeting here, these poverty programs. And so it really is a disincentive to work. It's a trap, as we call it, because you fall off the cliff. And so people make rational decisions. If I'm going to work more and get less, then what do people do in their microeconomic decisions? They stay on government benefits and they don't work more because they have to take care of themselves. They're making a rational choice given their situation. So in the Upward Mobility Act, we will combine the basically 8 poverty programs that we have, put them in a unified funding stream, give 5 states the ability to build a pilot program that would help people gradually wean themselves off of government benefits as they earn more. The scenario that I would like to describe. That family member that I talked to you about, they're working 20 hours a week. Well, what would help them get a job working 40 hours a week? Get them to that point where they might get health care from their employer, where they might get a 401k retirement plan, and then gradually reduce benefits. Because understand, people living in this is not an easy thing. If you're in poverty, you have no savings. So that means you don't have a down payment for an apartment necessarily. You don't have a car. You don't have some of the essentials that you need. So give them time to build some savings. Give them time to do that. And then you can gradually reduce benefits over time. And the way it's structured is the money goes to the states. We're not trying to do this on cheap. We're not trying to cut benefits. Any savings, though, that the state would accrue as a result of that can then be used for the next individual that you're trying to get off poverty. And if we can get 1 out of every 10 people in the country to do what I just described, it would be the equivalent of adding 1.5 to 3 million people to the workforce. So it's good for employers who need a workforce. It's good for the individual, and it's good for the culture of our nation, where we reinstill the idea of work and upward mobility, self-sufficiency, and restoring the American dream for many people that have been trapped and kept out of it.
Senator, there's a couple key data points that I think reinforce what you're saying when you talk about the benefit cliff as being a very real work disincentive. Here at Sutherland Institute in Utah, we surveyed statewide current or recent safety net participants in a report that we released in 2024 that basically asked, have you ever turned down a job opportunity of some form because you're worried about a benefit cliff? And our survey data showed that overall, about 43% of the safety net population had turned down some kind of economic opportunity because they were worried about a benefit cliff. So even in Utah, with the highest upward mobility in the nation, one of the strongest economies in the nation, 43% had said no to something because they were worried about a benefit cliff. And that's really acutely in, about 1 in 5 said they worked fewer hours. About 13% said they actually turned down an offer of a new job. And so it really kind of underscores the fact that there is a real disincentive effect in our current system. And I want to pinpoint something you said, because when you talk about what you envision the Upward Mobility Act doing. Why is it important for states to have this kind of flexibility? What kind of things do you envision a state doing, a state like Ohio, a state like Utah, under the Upward Mobility Act? What could we do to fix this?
I come at this from a life of experience of trying to fix it, right? I started out working in county government. I worked in state government. I was the lieutenant governor. I was in charge of workforce issues. And I kept bumping into this problem wherever I would go. You talk to people living in poverty and you say, well, why don't you work more? It's like, well, because of the benefit cliff, okay? You talk to an employer, anyone who hires entry-level people, whether it's in the hospitality industry, the manufacturing industry, they'll all raise their hands. They'll say, how many employers have offered somebody a job and they said no because of the benefit cliff? And every hand goes up. Like everybody knows about this problem that's existed in our poverty system for 50 years. But it's amazing to me why no one's ever done anything about it. And when you ask that question, it's because poverty programs are spread out all across government and you have to put them all together because every person in poverty isn't there for the same reason. And they may piece a life together based on a little bit of assistance from each one of these programs. And so you have to give that unified funding stream to tailor a program for every individual because every individual's needs are different. And people living in poverty are just not very, they're not very experienced at navigating the real world, right? I remember talking to one young lady who said, well, I don't really know how money works at a grocery store because she grew up and has lived all of her adult life using SNAP cards to buy groceries. And so you literally have to teach people how to budget, how to do all these things. So you gotta, there's some casework involved with this too, but the governors need flexibility. The caseworkers need flexibility in these funding streams to design pathways out of poverty. I want to share with you though, one very insidious aspect of how the poverty trap works that I don't think a lot of people probably know, because I was a big advocate for career technical education, right? Helping young people in high school become welders, auto body mechanics, CNC machinists, whatever, to take a career skill, get a work experience in high school, a certification, and then go to work, right? But I was at a high school in rural Ohio, low-income county, and the principal said to me, you understand that even the kids who get these skills, if they come from poor families, they can't go get a job. And I said, explain. And he said, yeah, I got kids that want to go be welders. They can't get a pre-apprenticeship or a work-based experience because any income they get counts against their family. So that means their younger brother or sister might not get food assistance. Their mom might lose her healthcare assistance, whatever it might be. Oh my gosh, can you believe that? I mean, that's what we do to people. And then we wonder why kids who graduate high school aren't ready for a career because we literally locked them out of developing the skills and having the pathway to do this. So that's just a few examples, real world examples of how the system is broken and how if we gave the money to the states, let them construct programs for each individual situation, that we can add more people to the workforce, give them a hope for a better future.
Senator, it seems that there are a few key themes that this ties together. Obviously, I really love that this is intended to be state-led, essentially saying, maybe the way I would interpret it, and correct me if this is wrong or add to it, essentially a way of saying, look, in Congress, we actually don't necessarily need or want, or maybe Congress just isn't well suited to cross-program comprehensive reform to the social welfare system, because by some estimates, it's well over 80 programs approaching $1.5 trillion a year, reporting through multiple federal agencies, multiple congressional committees. And so the idea of sort of going to that system on the national level and saying, be really innovative and creative with cross-program comprehensive reform is just really tough for a number of reasons. But if we can sort of angle it back to the states and say at the state level, states can be a lot more responsive to the unique needs of their residents trying to get out of poverty. And also it leans into this principle of federalism that at the state level, they can be equipped to be innovative, be creative, try new ideas at the state level. And so I love that federalism angle. I want to ask you if there's a way that can become sort of a broad consensus bipartisan principle. That's the way I read it. What are your thoughts?
So there is no way for the federal government to design a solution for every individual. You can't do it. You have to have flexibility, and you have to trust that governors care about their states, that the people who run, the delivery system in their states cares about helping individuals. Again, we're not talking about cutting anyone. We're talking about giving them the ability to earn more so they don't have the dependence. But that might, in one individual's case, it might be 1 month that they need an extension of benefits. And for others, it might be 6 months because they just have a more complicated situation. And you have to trust that governors are going to design a program to be able to do this. Look, it doesn't work when you do it at the federal level. It's 50 years this has been failing our nation because we lack the ability to trust. And I think that if you give this unified funding stream to governors and you hold them accountable based on results, like we can measure the results. This is an easily measurable system to find out whether we're helping people or we're not helping people. And then you judge it. It's a 5-year pilot program. Then you judge it based on those results. And then we learn. Because you know what? I've been working on this issue for 30 years, okay? I don't know everything. Like I can't possibly know everything. You have to trust that the caseworkers who care about these people are going to do it. You have to trust that employers are going to design systems that will help them hire more people and the individual get ahead. Because look, every employer wants their employees to be successful because turnover is a hard thing on employers, right? They want to have reliable employees who are successful at their businesses. And when you trust the states to do this in collaboration with your local not-for-profit partners and your private sector partners, then you have a chance to solve a complicated problem.
Senator, last question in the couple of minutes that we have left. I want to ask you about kind of what's next, meaning if you were to distill all this down to one key message to governors and legislators at the state level, to your colleagues in the Senate and the House at the congressional level, and also kind of what's next for the bill? What's kind of the key message to those groups, and where do we go from here for the Upward Mobility Act?
If you want a solution for people who've been trapped in poverty, the Upward Mobility Act is their way out and their way up. And I just say to my colleagues, because if you want to help, if this the buzzword today, let's face it, it's affordability, right? There's nothing that the members of Congress can do to help the lowest income earners in this country more than giving them the flexibility that's available in the Upward Mobility Act to help them earn more, build some savings, get access to the benefits that private employment provide, and help them become part of the middle class. There's nothing. Find one thing of a bill that's pending in Congress that helps individuals who are lowest income earners get ahead more than this, and I'll vote for it. But this is the bill that gives us a chance to end the poverty trap.
Thanks for watching that clip of Defending Ideas. For the full conversation, click the link in the description and make sure to like and subscribe wherever you get your shows.